Hi, everyone. This is Dr. Paul Zeitz. I'm here today on Monday, April 6th, 2020. It's 210 days till the 2020 election. I'm here today to help you manage feeling overwhelmed about the scattered and complicated information that is pouring in about the COVID-19 pandemic. I've seen a growing concern over the past week about misinformation and fake news, and a lot of people that I know have lots of questions. And so I'm here today to try to respond to all of your questions. As an experienced infectious disease epidemiologist who's worked on AIDS, TB, malaria, and hantavirus epidemics, meningococcal, pneumonia, the plague, over the years, I've taken it upon myself to diligently track the outbreak and response in the US and globally. And I'm here today to share my perspectives with all of you about what's happening and what else can happen in order to respond effectively to the pandemic. Religious gatherings are one of the major modes of transmission. So that is true for people of all different religions, and it's true all over the world. So the South Korea outbreak was identified to have been exploded in a religious group that over 9,000 people in one particular religious group led to sparking that epidemic in that country. There are lots of problems going on right now around religious groups, Orthodox Jews who are still attending weddings and funerals. There was a rabbi who died of COVID up in Brooklyn, and the whole community was in a community funeral. The police had to be called in to try to break up the crowds, because those folks, while they're taking the risk for themselves, are also increasing the risk for all of us by increasing community transmission, as I just talked about. Some really good data now coming out that a certain percentage, not all, I'm not exactly sure if we know exactly what percentage of patients or people that get infected with COVID-19 actually experience this phenomena, but it's significant and it's been consistent across the world. So I just saw a New York Times article about Google Analytics that are looking at Google searches for loss of smell. And they show that the pattern of people searching for that question is correlated to a spike in the infection rate. So there is a way now that they're using that to sort of track where the epidemic may be occurring in ways that are different from the reported data. So for example, they showed a big spike in the population in Ecuador that are searching for that question, while the national reporting out of Ecuador doesn't show a very big epidemic, but it looks like there might be a very large epidemic in Ecuador. Why exactly that is happening, I think, is still being studied. There are neural pathways from the brain to your face to where the cranial nerves connect to your nose and to your mouth that allow for your taste and your smell function, senses to operate properly. So it's possible that the COVID infection is impeding those neural pathways and blocking them right at the point of most probable place where the infection is entering the body. So if you inhale a droplet or you inhale a droplet that includes the virus is binding to your cells in the nasopharynx, and the cranial nerves are running through that same zone. So there's possibly some interaction that's occurring right there. I haven't read any definitive report about how that is operating, but that's my deductive reasoning as of now. There will, of course, be people studying it. I think the really interesting question is this an early warning sign? So can we identify where there's an uptick of that, or for people, the public, to, if they start sensing that, is that an indication that they might have a COVID infection? That's a good indicator, especially if you're not able to get a test, because testing is still hard to get in many places of the country. Dr. Fauci is 79 years old. He's been the head of the National Institutes for Allergy and Infectious Diseases for, I think, close to 40 years. He's worked with presidents going back to Ronald Reagan, George Herbert Walker Bush, Clinton, Obama, George W. Bush, Obama, and of course now President Trump. So he's been through the political yo-yos. He doesn't have a political affiliation. He's committed to public health and public welfare, and he's committed to saving lives. And I think his wisdom and his experience in dealing with many other epidemics throughout those decades has really proven itself to be value added, even for President Trump. Even if President Trump doesn't agree or wants to do things differently, I think Dr. Fauci has the kind of global credibility to survive, the vicissitudes of the political machinations. I don't think he'll step down or step away from playing that role within the government. He knows that all of us are out here to hold the government accountable. Certainly the elections coming up, that will hold the government accountable. And he's got to be there at the table trying to influence the policy decisions day to day right now in this kind of emergency phase, but also as we develop a plan for the fall for 2021 and beyond. I think having Dr. Fauci there is great, and he will stay there, is my prediction, as long as he can. As long as he's alive, he'll stay in that role. There are a lot of clinical studies going on right now, as you know, for tracking people that have severe COVID-related illness, those that are going into acute respiratory pulmonary distress, ARDS, it's called. Those are the ones that are requiring ventilators. People with moderate illness can go into severe illness and then life-threatening illness. I haven't seen, I think there are some studies that have come out of China looking at those kind of questions, and there are some early studies coming out of Italy. I don't think there are studies that I've seen yet coming out of the United States. There is a COVID physicians group that health providers like yourself could access on Facebook, where there's a lot of pre-publication research that's being put out. That's another phenomena that is happening at a great velocity, where instead of waiting for it to be peer-reviewed or published in a journal, a lot of medical researchers are putting out their pre-publication versions of their science. There are antibody tests being produced around the world in other countries and here in the United States. I just was on the phone with a group in New York City that's tracking the studies that are underway about antibody tests. I know there are tests being used in the hospitals now in New York City. I don't know the details of how many have been approved by the FDA. I would suspect that there'll be multiple efforts to develop develop the best possible antibody test, and that FDA will review and approve those, and then companies will start producing them. So there was a study published in March showing that there was some correlation between severe COVID illness and A blood type, and there was a less people with O blood type had less severe illness. I think that was a small study, and I haven't seen that study replicated yet with a larger number of people or in other countries like Italy or the US yet. I'm sure that is being studied as part of identifying risk factors. When this kind of pandemic happens, there are people that are studying and testing all these new therapeutics, all the people studying vaccines, and there's a whole other set of people that are studying the clinical syndrome, the COVID-19 respiratory distress syndrome, to try to identify common risk factors so that we can identify the most vulnerable people up front and fast.